We can take these off now. Thank you everyone for joining us this evening. We are joined today by Mary Woods MBE. Well done you. And so Mary is a nurse consultant with so much experience, and you specialise in lymphedema and have done for quite some time, haven't you? And I think both Mary and I work for Percy Health, and so we've had a bit of interaction, and was blown away by your knowledge. And I thought this was such a great opportunity to address some of the confusion, perhaps misunderstandings around exercising and lymphedema, but mainly to provide clarification and reassurance for those who potentially are at risk. So I thought we would start, Mary, by if I could get you to introduce yourself and tell everyone what you do.
Sure. Yeah, so thank you for asking me to join you. It's a real privilege to be doing this, first for me. So I've got a very long history of working in lymphedema. I've been in oncology for nearly 40, well, I was in oncology for 40 years, just shy of a couple of months. And the majority of that has been in the specialist area of lymphedema. So I sort of headed up the service and developed, protocols, care pathways, spoke internationally, nationally, wrote a book, and did a lot in my career in lymphedema, and I was really privileged to get the MBE this year for all my hard work in lymphedema. It was it was absolutely lovely to be acknowledged for all the work that I've done, although I must say that it doesn't come without others involved, and I have to acknowledge all the people that have been part of my journey along the way. So there's no such thing as doing something in isolation.
No. And very well deserved, it sounds like, as well. So well done.
Oh, thank you.
So we thought we would start today, and sorry if this is a bit more basic for some people, but actually just a bit of clarity to explain to us why some of us are at more risk from lymphedema than others, and who exactly is at risk.
So yeah, it's a really confusing area, because what we know about lymphedema is that anybody who has any intervention, any surgery, radiotherapy into the lymphatics is at risk of developing lymphedema, because there's been some form of trauma to the lymphatic channels and the vessels. And that has the effect of maybe slowing things down a little bit. But having said that, not everybody will get lymphedema. So the answer really is that everyone's at risk, but that doesn't mean that that person will get lymphedema. And we know from research that it's approximately a third of women will get lymphedema at some time frame throughout their life. And we also know from research that if people are going to get lymphedema, it often develops, or is most likely to develop within the first year after treatment. Now the risk is lifelong, but if it's going to happen, it often happens within that time frame of the first year. That's what research is telling us. Now that doesn't mean that people won't get lymphedema later on, because they could do, but the majority of statistics and indications are that it's within that first year if somebody is going to get it. What I should emphasize though is that after that first year, it's really important that people remain vigilant about looking after their at-risk limb, whether that's an upper limb or a lower limb, because that risk is still there.
And in terms of the number of lymph nodes that you've had taken, does that impact your risk?
There's nothing to suggest that. I mean, everybody has a different number of lymph nodes in their body anyway. So throughout the body, there's hundreds of lymph nodes, and within the time of surgery, it may be that somebody will have 2 nodes removed in the sentinel lymph node situation, or maybe more if they have an axillary node clearance. I guess if you could say really that the more nodes that have been removed, the more the risk is there, but that doesn't always follow, because we've seen people with a large number of lymph nodes removed who don't get lymphedema at all, and yet somebody with just a small number of lymph nodes removed that do get lymphedema. So it doesn't really help us, and it doesn't help people who are in that position of being at risk of lymphedema when I answer that question and say, we can't categorically say yes. If you've got more nodes removed, you are more at risk, or less, you aren't, because it doesn't always follow. The biggest thing to remember is that the risk is there, and by careful sort of care of the arm and sort of monitoring, it'll minimise that risk as much as possible.
And what kind of symptoms should people be aware of and start to report if they experience?
Yeah, that's a really good question, because a lot of people think that if they get lymphedema, they'll wake up one morning with swelling in their arm or in their leg, if that's the case. And that actually isn't the case, because there are often some warning signs before then. And they're usually along the lines of feeling a sort of heaviness in the arm, something that just doesn't feel quite right. It feels a bit heavy, maybe a bit sort of different, just different. And a bit like if you've done, a heavy bout of exercise, for example, and the muscles are feeling uncomfortable, except it would just be in the at-risk limb, the at-risk arm in this situation for breast cancer. And that is the warning sign, really. And again, there's been research to show that these symptoms are an indication that the lymph load is a bit excessive and the body's trying to cope. And if those symptoms are ignored, then that might go on, and I stress might, go on to lead to swelling. And at that point, it might be quite transient. It might be quite mild swelling. It might come and go. It might be there one day, not the next, and not there for another couple of weeks. So it's not a question of just waking up one morning and having a big arm. And that definitely isn't the case.
Okay. And if somebody experiences those types of symptoms, what's the best thing for them to do?
Well, the best thing to do really is to think back to what might have caused it. So an example of thinking back is one I always give is a bruise. So if you say you knock your leg, for example, on something, and you think, oh, ouch, that's a bit sore, and you rub it, and then you forget about it. And a couple of days later, you see a bruise on your arm, bruise on your leg, and you think, did I do to cause that bruise? And you've totally forgotten. And it's a little bit like that with an arm that then begins to feel a bit heavy and a bit uncomfortable, because it's usually related to something that was done a couple of days previously that you may have forgotten about, or that person may have forgotten about. But it's trying to think about what might have been, was there something particularly exertive that happened that day? Was there some heavy shopping carried, really heavy shopping? Was there something particularly different about that day that the arm was used for, that might have been a contributing factor? Sometimes it's difficult to remember, but it's about thinking about what it might have been and avoiding that in the future. Now, if that isn't possible, if you can't remember what happened or what you did, then just resting the arm, trying not to overexert it, trying not to do anything too much until it settles down again, and then just getting back to normal.
Okay. And we'll go on to talk about a little bit more about exercising with lymphedema as well afterwards. And in terms of reporting it, should it be reported straight into your oncology team or the lymphedema team?
No, I don't think so at that stage. I think, there's a great temptation to panic, and people do worry about lymphedema. And obviously, it is a worrying thing if swelling does appear. But I think in those early stages, it can be self-managed. It's about having that awareness, having that self-awareness, self-care. But if the symptoms of early swelling become more persistent, so if there's early swelling there and it doesn't go away, or there are other things that people are worried about, then yes, of course, get a healthcare professional's advice. But in the early stages, when things are perhaps the arm is a bit heavy, there's some difference in perhaps what's been done over those few days, I think it's self-care is the key then.
Okay, brilliant. And in terms of prevention, what is the best way to prevent lymphedema when exercising, specifically when exercising?
So I think we have to be careful using the word prevention, because remember that all these people are at risk of lymphedema, so we can't prevent it. What we can do is minimize the risk. So it's about risk management. That's basically what it's about, lifelong risk management. So exercise obviously is a very key part of people's lives, and it's really, really important that people do move. Absolutely essential. And I come across lots of patients who are really cautious about what they do with their arm because of this risk of lymphedema, and to a certain extent that's right, but we do have to move. The lymphatics work best through muscular activity, so if we don't use our muscles, we're actually storing up problems for the future. So it really is important for people to move. And the government guidelines for activity are 150 minutes a week. Now that's broken down into manageable chunks for most people. It's the type of activity that people do that's really important. So recognizing that movement is important, that exercise is important, it's the type. So thinking about using a full range of muscles. So rather than just using one muscle group, using a full range of muscles. So activities that use a full range of muscles, such as swimming, is excellent, walking, running, where the arms are being used, the legs are being used. Aerobic type exercise is really good. Yoga, Pilates, all of those activities are absolutely fine. And lots of people have done activities in the past that they want to go back to, and that's really, really important as well, that people get back to what they've enjoyed, because if we ask somebody to do a different type of exercise, they may not enjoy it. So it is important to go back to what they previously did and what they enjoyed, and just essentially building that up slowly. So listening to the body, starting slowly, not just going back full pelt, just beginning to take things slowly, take things easily, build it up as they go along.
Yeah. I mean, as an exercise professionals, we're obviously taught those guidelines around slow progression, making sure that we don't put too much pressure through affected areas, albeit shoulders or groin, and things like exercises where we're holding something for quite a long time. So you talked about shopping, but from an exercise point of view, there are exercises like a plank, like a full press up. In yoga, we've got things like downward dog, where we're using a lot of shoulder pressure. And I suppose that's where we as exercise professionals kind of get questioned, well, why can't I do that? And there is, as you've kind of mentioned, it doesn't seem like there is a specific study that I can refer to tell you that. But it's the risk factor that we are concerned about, and the risk factor is why we're taking that extra caution and those precautionary measures, because we don't know from one person to the next who might get lymphedema and who doesn't, which is why we kind of avoid those exercises, or we progress them nice and steadily.
I think it's important not to avoid them. If somebody has been doing yoga for years or Pilates for years, and they're quite familiar with those movements, it is important that they do use them again. They do go back to them. So it's better not to avoid them, but just to progress them slowly, and really build up, rather than just avoiding. If somebody's new to Pilates or new to yoga, there are lots of other movements that they can do without doing those ones, particularly at the beginning. And if they do find themselves in a position where they're doing those movements just to do them for a very short period of time.
Yeah. We're talking about a fairly long hold, aren't we? Kind of minute plus.
Absolutely. A minute plus is probably a long period of time for someone who's new to that activity.
I think I think some people find it hard without specifics, and but as you said, it depends what you did before. If you're coming back to heavy strength training that you did pre-cancer, you do need to step it back, but you can progressively work back up if your body is used to doing something like that. And the same with yoga. If you were downward dogging regularly, but you want to go back to that, you just progress on lower impact versions to progress back up to those types of moves.
Absolutely. And you've really nailed it there, because there is no manual for what people should do. There's no set of rules. It is so individualized according to what people have done before, what they're capable of doing. Of course, everyone's tolerance level for exercise varies anyway.
And having a really good awareness, as you said at the beginning, of what happens those days afterwards, making sure you make note of the exercise that you did, perhaps, so that you can see how your body responds. And that's what we try to tell the people that we work with is, wait a couple of days, see what the response is. If your body feels okay, you can carry on. It's okay. But being very aware of that heaviness and any other types of symptoms that they start experiencing.
Yeah, that's absolutely right.
Brilliant. For those who have exercised before, so we get quite a big range of people that come and talk to us, and they're looking to start progressing their weight. So this is, people have started to build up confidence in different types of training. I work a lot with women who have strength training, and they're talking about how quickly they can progress their weight. So I suppose the same applies really.
It does.
It's nice steady.
Yeah, it does. I mean, there's so many types of exercises, and I said right at the beginning, it's important to have a full range of exercises that use all muscle groups. That's really important, and I would never, suggest that one muscle group is focused on. And women often want to go back to, exercise and, get rid of bingo wings on their arms and, use weights to try and help that. And really, it's okay to use weights if you start really, really slowly, but don't just do weights. Do other activities as well. And that's much more effective and much better than focusing on just one muscle group.
Yeah, or one particular exercise.
Yeah, or one particular exercise, yeah.
Someone has asked if there's a maximum weight they can lift. So my response would be no, but again, progressing nice and slowly to get to that weight. Yeah.
I mean, some people will never go more than a couple of kilograms, whereas others manage more. And again, it depends on that person. It's so individualized. It's so important to keep that individual thought in mind, that each person's tolerance for activity without having had breast cancer treatment is different. But following breast cancer treatment and building up is also very individualized.
Yeah. I think sometimes the advice is given perhaps by someone that sets a number that thinks like 5 kilograms, for example, is heavy, but that person that they might be talking to thinks, oh, but 5 kilograms was like my lightest weight before, and I can't lift more than that now. So it is an individualized approach, and it's important to see what you did before and then progress back from there.
And just listening to the body and working through, what happens after trying that activity.
Exactly. And I think that diary keeping is something that I try and advise people to do, because it's quite helpful at recording symptoms, not just from lymphedema, but from side effects of cancer treatment as well.
Absolutely.
So those who have existing lymphedema, so we have a lot of women that come to us who already have existing lymphedema, should strength training be avoided?
No, not at all. Not at all. They're absolutely okay to do. It's important to use the muscles, important to get lymph flowing through those lymphatics by using the muscles. So no, they don't need to avoid strength training. It's how much they do and the type. So again, that individualized approach and listening to their body is the key message. And taking advice from a professional, because it's hard work if you're trying to do that on your own. Trying to work out what you should and shouldn't be doing and listening to your body. Sometimes just having, that advice from a professional gives you the confidence to exercise, and also the advice about how to exercise, how to do those strength training exercises and movements.
Yeah, especially if you have limitations within your mobility as well, making sure that people are actually lifting weights correctly so that they remain injury-free.
Absolutely safe.
I know there's actually some new data, it's not so new anymore, but it's about a year old, I think, is that actually if you have existing lymphedema, and for those more at risk from lymphedema, strength training can be a really helpful tool at helping reduce swelling, but also preventing development of lymphedema.
And it all comes back to and it all comes back to the movement of lymph through the tissues. The more activity, the better. It's the type of activity and making sure that the activity is correct for that person that's so key. But activity of any kind, strength exercise, full body exercise is so important. In general life, but certainly after cancer treatment and getting back to normal. And with people with lymphedema should still be exercising. It's so important that they do, and for the reasons we've just talked about.
And just a note to anyone that is watching that does have lymphedema, you do need to wear your compression garment when you are exercising. Very important. And in terms of the care of your arm in your affected or leg, so we have some people who are watching who have lymph nodes in their groin removed. How can you care for your affected side? So what if something, you were to injure yourself, for example, what's the best way to care for yourself?
So there are a couple of key factors involved when somebody is at risk of lymphedema or somebody who's got lymphedema. So it's the same messages across both, really. The things to look out or to really focus on are skincare, so avoiding infection, because the lymphatics on that side are reduced in number. So there's a bigger risk of infection in that arm if we're focusing on an arm, or in a leg if we're focusing on the leg. And that just means simple care. So if there's a cut or a break in the skin, treating it antiseptically so that there's a risk, or the risk of infection getting into the tissues is reduced. And that doesn't have to be anything too dramatic. You can just use one of those little antiseptic wipes or a little tube of antiseptic cream and just slap a bit on, or wipe it with the antiseptic wipe. That's all that needs to be done if a cut or a break happens. And we can't avoid cuts and breaks completely in our lives, can we? We always get something. But the things we can avoid are things like mosquito bites, sunburn. There's good care there if you're going to be in an area where the mosquitoes are out biting. Use a good insect repellent is absolutely essential to avoid those mosquitoes having a little nibble, because what they do when they have a little nibble is put a bit of poison into the body, and it's also an entry site for infection. So warding them away is really important. And obviously sunburn damages the skin. So using a good high factor sun cream is also really, really important. So care of the skin, keeping it in good condition, moisturising it regularly to make sure there's no dry, flaky areas is really what should be followed in terms of skincare. And then exercise is really important to keep those lymphatics flowing, to keep the movement going. But obviously, as we've just alluded to, being cautious about how to use the arm and making sure that it's the correct type of exercise for that person. So those are the two key messages really for someone with lymphedema, existing lymphedema. If they've been fitted with a sleeve or a compression garment for the leg, it should fit well, and if it doesn't, they must go back to a healthcare professional and get it fitted properly, because if it doesn't fit properly, it won't be doing its job and it's uncomfortable. So it's really important that they have the correct garment. So those are the sort of key areas for somebody with existing lymphedema. And for someone who's not wearing a compression sleeve, obviously following good skincare advice and exercise are the two areas that they should be following lifelong.
Okay. And you mentioned a bit of self-care, so there's skincare, and are there any techniques that we can use, really simple techniques that you can use to help with your own lymphatic drainage?
So, well, that's a very difficult one to answer really, because again, the research about lymphatic drainage is a little bit controversial, and it's not clear cut. So lymphatic drainage refers to simple lymph drainage, where people are actually massaging the lymphatic channels themselves, or manual lymph drainage, where people are manually having their lymph channels drained by a skilled therapist. So if we focus on simple lymph drainage first, arguably that can be done by anybody if they're taught how to do it. So there are some videos on the Lymphoedema Support Network channel, for example, that do guide people towards doing their own lymphatic drainage. But it doesn't need to be done by everybody. There's no research to show that it's actually going to be something that they have to do. What they do have to do, or what they should be doing, is skincare and exercise. Those are much, much more important than thinking about lymphatic drainage. And of course, manual lymph drainage is for somebody with existing lymphedema. There's no evidence to show it's of any help at all for someone who hasn't got lymphedema. And there's limited evidence really to show that it's beneficial on its own for somebody who's got lymphedema. It may be useful for some people if it's used with other aspects of treatment, but it has to be a therapist that just makes a decision about that, not a patient.
And there is also a new therapy around, I'm going to not pronounce it, but LVA.
Yes.
So one lady's asked, she's been referred for LVA after axillary node clearance. Can you explain what it is? And
yes, I can. So LVA refers to lymphatic-venous anastomosis. Very complicated word, but basically what that means is that a small blood channel, very tiny blood channel, is sewn to a lymphatic, and the purpose of that, and this is microsurgery. So a lymphatic vessel is smaller than a hair. Basically, the hair on your head, it's tiny. So this is microsurgery with really highly microscopes that a surgeon is using, and the surgeon has to be very skilled in the technique to be able to do this technique at all. It's not available on the NHS, and it basically is to encourage lymphatic drainage from an area where there is congestion to drain into the blood system. So we're not talking about great volumes here. We're just talking about a little bit of a divert for the lymphatic channels. But it's not really thought to be of benefit to somebody who hasn't got lymphedema. And if we go back to what I said at the beginning, remembering that not everybody gets lymphedema, you have to question why somebody who hasn't got lymphedema would want to go down that route if they might never get lymphedema. So really, its benefits are, and there's research at the moment going on to try and work out which patients will benefit from it, whether it's patients with early lymphedema or those with more long-standing lymphedema. But certainly the early research is indicating that those patients who've got early lymphedema are more likely to get a better outcome from it. Now, that outcome might not be lymph volume reduction. It might not be a reduction in any swelling, but it might stop it from progressing.
Okay.
Once lymphedema is more established, it's a little bit harder to make those changes because the tissues begin to undergo some changes, and it's a bit harder to get the successful outcome that person would be looking for. But it isn't, there's no firm research to guide us in that practice either just yet.
Yeah.
I know that it's been offered to some patients, but it's about thinking very clearly about what the purpose is and what benefit there might be.
Yeah. Okay. Very interesting. A few questions now on specifics of equipment and exercise. One lady asked actually just before we came on about hot and cold. So she does saunas and then cold water treatments. How do you feel about those combinations when I can't remember whether she had lymphedema or whether she was at risk from lymphedema?
So that again is quite an interesting one because we've always said avoid going from getting particularly hot to then jumping in a cold plunge pool and getting very cold very quickly. And the rationale behind that really is that we want to have a steady state really with the lymphatics. So we want them to work, we want them to encourage them to work. But if you're having these extremes of dilation and then constriction, and again, there's no research to support this, but physiologically, we don't know really what that's doing because the blood vessels constrict very quickly if you go into a very cold environment, such as a cold plunge pool. And would that then cause some problems with the lymphatics as well? We don't know. We don't know. This advice, as with some other advice in the lymphedema sort of area, isn't always based on strong research evidence. It's based on physiological assumptions, really. And that there's nothing wrong with that at all, but it's just hard when advising people because if somebody has always done that and they're at risk of lymphedema, arguably they could probably carry on. But if someone's got lymphedema, it might be a little bit maybe not do it too much, try it, see how you're getting on. But if you go into a hot sauna and your blood vessels dilate and then they constrict really quickly, the whole purpose of that is to sort of, it's for health benefits, isn't it? But we have to think about what it's doing to the lymphatics as well, and we don't really know whether there'd be an impact for some patients.
Okay. There is another piece of equipment, a rebounder, so it's a bit like a trampoline. Have you had any experience with patients using these and how whether they're effective or not? My view is I don't see any huge impacts. I think generally exercise and movement, as you said, is beneficial, and any type of exercise that you enjoy is important. So if you enjoy going on the rebounder, I think that's great. Watching pelvic floor, but
I absolutely agree. I think if somebody enjoys that, then do it. But it's not going to help their lymphedema. I don't think there's anything, or being at risk of lymphedema, it's not going to impact on that risk or any swelling that may be present. But if that's what somebody's always done, then that's fine. It's if they're at risk of lower limb lymphedema, again, it's just caution. Think about what's happening to your body. Pay attention to any changes that they might experience.
Okay. And one last question, I do get asked this a lot, is whether cording and lymphedema are linked.
Okay, yeah. So Cording and lymphedema are both conditions that affect the lymphatic system, but they're not related. There's no relationship between the two. They're two separate situations. Cording happens actually more frequently than lymphedema, surprisingly, because a lot of patients or people will experience some level of cording post breast cancer surgery, but obviously we know that not everybody gets lymphedema, and cording is thought to be due to some form of almost like tightening of the lymphatics in response to the surgery. So sort of a bit of an inflammatory response in a way to what's been happening to the lymphatics. It often occurs in that period post-surgery, sort of 6 to 8 weeks is probably the maximum, but that doesn't mean it'll never happen. Some people do get it weeks or months later than that. And it does generally resolve quite well with advice from a physiotherapist and appropriate exercises to sort of encourage those lymphatic channels to settle down, to ensure they don't become too tightened. But getting the advice about the appropriate exercises is what's really important. But it doesn't mean that somebody with cording is going to get lymphedema. Absolutely not. That's really important. Yeah. They're reassured about that.
Yeah, I think that's a really important message as well. Okay, so key messages from tonight. Exercise is good. Skincare is very important.
Yeah.
Progression is key, but within your own personalised world. So if you did something before, progressing back to that level. If you haven't done something before, starting nice and gently, but always listening to your body and seeing what the response is a day, 2 days after exercising.
Yeah, it absolutely is. But exercise is so important. What I really don't want is for people to be frightened about doing exercise. It's really important to start with something, even if it's something that they don't feel is hugely challenging for them. Yeah. It's a start, and then build up from there. It's so important to get back to movement, and that can happen very quickly after surgery is those movements. And certainly most people are given some physio exercises at the time of surgery. It's really important that those are followed, and that even if people do nothing else to start with, do those exercises, because they're all designed to promote movement and encourage lymphatic drainage.
Yeah. Oh, Mary, it's been absolutely fascinating. Thank you so much for joining us.
Very welcome.
Really appreciate it. And please, thank you for everyone for all your questions. They've been brilliant, so useful. We hope that has given you some clarification in some of the uncertainty around exercising and lymphedema. If you do have any further questions, please do ask them in the comments, and really appreciate you all joining this evening, especially you, Mary. Thank you.
Thank you. Thank you to everyone who's joined. It's been a pleasure.
Thank you. Take care, everyone. Have a lovely evening.
Bye-bye.
Bye.
Bye.